We're hearing next from Jill Hobbs. She's Mingle's subject matter expert on MIPS Quality. Jill is a clinical quality program consultant for us. She has background as an RN working quality improvement in an ACO. Welcome to the session, Jill.
Thank you.
Jill, how will the quality category change in 2023?
Yeah, so the quality weighting specifically will remain at 30% of your final score, and it is will be staying that way for the remainder of the program. We have capped out on that 30%. Your performance threshold, meaning how you avoid the penalty, will remain at 75 points, so no change there. Your data completeness, and that means how the number of patients that you report on, that will remain at 70% for 2022. However, it is of note that that will be increasing to 75% in 2024 and 2025. That had come out in the final rule as well. One of the biggest changes is that there's no longer an exceptional performance bonus. So in 2022, that was the last year those bonuses will be awarded. So 2023, those will no longer be there. If you've been utilizing the web interface reporting method, that also will be sunsetted in 2022, and that's for traditional MIPS only. That will remain for APMs to have that option in 2023, but not for traditional MIPS. So web interface will no longer be an option. And lastly, for changes in quality, there are 11 measures being removed. 2 that will be partially removed, meaning they will only be available in the MVP reporting, and there will be 9 new measures for you to choose from. And that's a total of 198 quality measures that you'll have to select from this year.
Great, Jill. Thank you very much. And I also understand that after talking about it for several years, health equity is starting to show up in the rules. Where are we seeing it in the quality performance category?
We're starting to see it in the definition of high priority quality measures. So, for instance, this year we have a new measure, measure 487. It's the screening for social drivers of health. So, that is a high priority measure, and that will count for your one high priority measure that you need to have when you select your top 6 measures, including one high priority measure. So, that is a measure that is for patients for screening for insecurities and instabilities and different screenings for social drivers of health in general.
Jill, a handful of quality measures were removed in the 2023 final rule. Will any of those removals negatively impact our clients?
Yeah, so every time that there are any measures removed, it could impact your submission. So you always want to be watching the measures that you utilize for your submission, especially when your eligibility may be limited to only a handful of measures. There are 2 measures specifically this year for 2023 that have been highly utilized, but have been removed for 2023. Those measures are measure 110, which is your influenza, and measure 111, which is the pneumococcal. These measures have been around for a very long time, and many clinicians have relied on these measures when they have limited eligibility with other measures. So it is of great note to take note of those 2 measures being retired for 2023.
And do you tell us where we'll still be seeing those measures?
Yeah, we do have a new measure that is coming up in 2023. It is the adult immunization status measure, but that is a measure that it will be a little bit different in that it's your influenza, your pneumococcal, but it also includes other immunizations such as tetanus, diphtheria, pertussis, zoster, those types of things. So it's going to be a group of immunizations, not just your influenza or your pneumococcal. So that will be a group of immunizations.
But we'll still see influenza specifically and pneumovax, will we not?
Measure 110 and 111 will be available in the MVP submission, but it will no longer be available in the traditional MIPS submissions.
Great. Thanks, Jill, for the great answers. You've been a big help.